Hello everyone, today we will be dealing with one of the bones of the lower limb, the femur. So as you might know, femur is the longest and the strongest bone of our body. It is a long bone and the upper end it attaches to our hip bone forming the hip joint, and the lower end it attaches to the tibia and the patella forming the area around the knee joint. That is the upper end, the shaft and the lower end. The upper end mainly consists of a head, a neck and two prominences, as you can see here, called the trochanters. This is the greater trochanter and this is the lesser trochanter. Now this is the shaft. The shaft is a long area which has a convexity which is faced anteriorly and directed downwards. This is the lower end. Here also we have two main prominences, this being the medial condyle and this being the lateral condyle. The most prominent part of the condyles are respectively called the epicondyles. So as I said, this is the medial condyle, right. So this would become the medial epicondyle and this the lateral epicondyle. The area between the two condyles is called the intercondylar fossa. Now we are going to talk about the most important part of when it comes to learning a bone in osteology, which is the site determination. This is the bone of the lower limb, right. So this is the upper end, as I mentioned before. The head should always be facing upwards, medially and slightly forward, something like this. Alright, the shaft is pointed downwards with the convexity facing anteriorly. The lower end has two condyles, both of which should always lie on the same plane. So this in my hand right now is my right femur. So whenever your professor asks you to present this bone on whichever side it is, you present it like this. Since it is my right femur, I balance it on my right index finger with the head facing medially, upwards and slightly forward. So this is how you show the bone to the professor. So this is my right one, so I am balancing it on my right index finger. Now imagine a long axis going through the shaft and through the neck. The angle between the long axis of the shaft and the neck is called the neck shaft angle. So this neck shaft angle is usually lesser when it comes to females, and generally speaking it is around 125 degrees in adults and 160 degree in children. Now we will deal with the femur part by part. The upper part has a head. This forms around 2/3 of a sphere, and this part is what articulates with the acetabulum of our hip bone forming the hip joint. So when you look carefully at the head, you have a small cavity here, right. It is called the fovea. This is where the ligament of the head of the femur called ligamentum teres femoris is attached. Now we come to the neck. The neck is what attaches the head to the shaft. The neck has an upper border, a lower border, and an anterior surface and a posterior surface. When you look at the upper border, it is a concave area, right, and it is horizontal. The lower, it is a oblique area. So the upper surface connects the head of the femur to the greater condyle of the shaft. The lower border is what connects it to the lesser trochanter. Now we speak about the anterior surface. The anterior surface of the neck is a flat area and consists of many bony ridges. So this anterior surface is connected to the intertrochanteric line. So what is this intertrochanteric line? It is a line connecting the greater trochanter to the lesser trochanter. Now the intertrochanteric line also facilitates to being the attachment point of four main structures of the lower limb. There are two muscles and two ligaments. The two ligaments being the capsule of the hip joint. The capsule of the hip joint is connected here. So what does that tell us? The anterior surface is completely intracapsular. The first ligament attaching to the intertrochanteric line is the capsule of the hip joint, and then comes the iliofemoral ligament, the strongest ligament of our body. And then there are two muscles as well, the vastus lateralis and the vastus medialis. There is an important structure present on the intertrochanteric crest. It is a tubercle called the quadrate tubercle. This quadrate tubercle forms the area where the attachment of the quadrate femoris muscle occurs. Now we talk about another structure of the upper end of the femur, which is the greater trochanter. Alright, so the greater trochanter, as you can see, is a quadrilateral prominence which forms or which projects upward, forming the lateral aspect of the junction between the neck and the shaft. So this quadrilateral elevation has one border, which is the upper border, and three surfaces in total. There is an anterior surface, a medial surface and a lateral surface. Speaking of the anterior surface, it moves upwards and has a posterior part which forms the apex or the tip of the greater trochanter, and here is where the muscle called piriformis is attached. So, this is the anterior surface, right. So, this is where the gluteus minimus is attached. There is a ridge on the lateral part, and this is where the gluteus minimus muscle is attached. Speaking of the medial part of the anterior surface, it is related to a bursa called the trochanteric bursa of the gluteus minimus muscle. So, that was the anterior surface. Now, we are going to talk about the medial surface. So, to see the medial surface clearly, let me just rotate the bone. So, here we see a fossa, a depression. So, this fossa is called a trochanteric fossa, present at the junction with the neck, and this fossa is where the obturator externus muscle is attached. When you look a bit above and in front of the trochanteric fossa, you see another shallow depression which forms as the point of insertion for obturator internus along with the two gemelli called the gemelli inferior and the gemelli superior. We are done with the medial surface now, we move on to the lateral surface. As you can see clearly here, the lateral surface is also a quadrilateral with a very clear oblique ridge dividing this quadrilateral into an upper triangular area and a lower triangular area. This ridge is what facilitates as a point of attachment the gluteus medius muscle. The triangular area, the upper triangular area which is present anterior to the oblique ridge is what is the point of attachment or is related to the trochanteric bursa of the gluteus medius muscle, whereas the lower triangular area which is present posterior to this oblique ridge is related to the trochanteric bursa of the gluteus maximus. Trochanteric bursa of the gluteus medius above and gluteus maximus below. That we are done with the greater trochanter. We move on to the next part of the upper end of the femur, which is the lesser trochanter. So, as you can see, the lesser trochanter is a conical projection, right. Where does it arise from? I mentioned before about the neck shaft angle, right. So, this lesser trochanter arises from the posteromedial surface of the neck shaft angle directed medially. How can we know if it is medial? It is because it is directed in the same direction as the head, right. So, where is the head directed? Is directed medially. So, the lesser trochanter is also directed medially. The apex of the lesser trochanter is where the psoas major muscle is attached, and the iliacus is also attached to the base of the front of the lesser trochanter. So, we are done with the upper end now. We move on to the shaft. The shaft is the most defining portion of a long bone. So, the shaft of a femur, it basically has 3 borders and 3 surfaces. The 3 surfaces being, there is an anterior surface, there is a medial surface and a lateral surface. Speaking of borders, there is a medial border, a lateral border and a posterior border. The posterior border around the middle third, it consists of a structure called the linea aspera. The linea aspera here, it has an inner lip, an outer lip and an intervening intermediate area as well. When you trace it upwards, it becomes a triangular area as you can see here. So, the medial line or the medial lip when traced upwards becomes continuous with the spiral line. As I mentioned before, the spiral line which is a continuation of the intertrochanteric line. So, it continues as the medial lip of the linea aspera. Now, the lateral lip when you trace it upwards, it becomes continuous with the gluteal tuberosity, and when you trace it even further upwards, it becomes the root of the greater trochanter. When we go the opposite way, when we trace the 2 lips of the linea aspera downwards, again it encloses a triangular space, right. This triangular space is called the popliteal surface which is present on the lower 1/3. The inner lip or the medial lip when traced downwards becomes continuous with the medial supracondylar line ending in the adductor tubercle. This was the medial condyle, right. So, the medial supracondylar line is where it ends, properly ending at the adductor tubercle. When we trace the outer lip or the lateral lip, it ends up being the lateral supracondylar line. So, the 9 main structures attached to the linea aspera from medial to the lateral side. At first, there is the vastus medialis muscle, then comes the medial intermuscular septum, then there is the adductor brevis in the upper portion and adductor longus in the lower part, then there is the adductor magnus, then comes the short head of biceps femoris, the posterior intermuscular septa, the vastus lateralis followed by vastus intermedius on the most lateral aspect. Now, we move on to the lower end of a femur. The lower end of a femur, it has 2 condyles, right. This being the medial condyle, the lateral condyle, and when you look posteriorly, there is a fossa between the two condyles, right. So, this is called the intercondylar fossa. Speaking separately, first we talk about the medial condyle. The medial condyle, as I mentioned before, has a prominent part called the medial epicondyle. So, the medial epicondyle is where the medial collateral ligament of the knee is attached. When you look carefully, there is another tubercle here. This is called the adductor tubercle. This adductor tubercle is to where the ischial head of adductor magnus is attached. And when you speak of the medial condyle in terms of the intercondylar fossa, you can see that the lateral end of the medial condyle is what forms the medial wall of the intercondylar fossa. Now, we are talking about the lateral condyle. So, the lateral condyle also has a prominent area. It is more stronger and stouter than the medial condyle. The lateral condyle also has a prominent area called the lateral epicondyle. Lateral epicondyle is where the fibular collateral ligament of the knee is attached. Now, talking of the lateral condyle, the medial wall of the lateral condyle is what forms the lateral wall of the intercondylar fossa. Now, you see this smooth area on behind this lateral epicondyle, right. So, this is where the lateral head of the gastrocnemius is originated, and there is a groove below and behind the lateral epicondyle. That is where the popliteus is attached. So, the tendon of popliteus is what occupies the posterior part of this groove when the knee joint is fully flexed. There is another portion in the lower end, right. There is an intercondylar notch here, a notch or a fossa. So, this is a notch which divides the two condyles posteriorly, right. This is behind, this is the posterior aspect. So, this intercondylar fossa, it has two walls, the medial wall corresponding to the medial condyle and a lateral wall corresponding to the lateral condyle, and a floor. Posteriorly, it is limited by the intercondylar line. Now, speaking of the two walls of this fossa, this medial wall is what provides the attachment to the PCL or the posterior cruciate ligament. So, medial to the posterior, medial wall provides attachment to the posterior cruciate ligament. Now, this is the lateral wall, and this is what provides attachment to the anterior cruciate ligament or the ACL. So, medial wall to the posterior, lateral wall to the anterior cruciate ligaments. It's not just these parts comprising the lower end of the femur. I had mentioned in the beginning that this lower end is what articulates with the tibia and the patella. So, this is also called the articular surface, this V-shaped structure. So, this lower end has the V-shaped articular surface, and it comprises of the anterior, inferior and posterior parts of both the condyles. The apex of this V here, this is called the patellar surface. This is a saddle shaped surface which occupies the anterior surface of the two condyles, right? The two condyles and the anterior surface. This is called the patellar surface because this is where the patella joins with or articulates with the lower end of the femur. Now, the two links of the V, this and this forms the inferior and posterior part of the both condyles respectively, right? So, this is what comes in contact with the tibial condyles. The medial and the lateral tibial condyles are what articulate with the two links or the two hands of the V-shaped articular surface. I really hope you've understood the basics pertaining to the lower limb bone femur. Please do read your textbook for further information. That's all. Thank you.